Epidemiology. Epidemiology is a branch of medical science that deals with the study of patterns, causes, and effects of diseases in populations. It focuses on understanding how diseases spread and identifying risk factors to prevent and control their occurrence. Epidemiologists collect and analyze data to gain insights into the distribution and determinants of diseases. Here are a few examples to illustrate the concept of epidemiology. 1. Disease outbreak investigation. When there is a sudden increase in cases of a particular disease in a community, epidemiologists investigate the outbreak. They study the affected individuals, their demographics, and potential exposure sources to determine the cause of the outbreak and implement measures to prevent further spread. For instance, if there is a sudden increase in food poisoning cases after a community event, epidemiologists may investigate the food handling practices, ingredients, and hygiene conditions to identify the source of contamination. 2. Risk factor identification. Epidemiologists identify risk factors associated with various diseases to understand their causes and develop preventive strategies. For example, epidemiological studies have shown that smoking is a significant risk factor for lung cancer. By studying large populations of smokers and non-smokers, researchers were able to establish a strong association between smoking and the development of lung cancer. 3. Disease surveillance. Epidemiologists monitor the occurrence and distribution of diseases in populations to detect outbreaks and trends. They collect and analyze data from various sources, such as hospitals, clinics, and laboratories, to identify patterns and changes in disease patterns. This information helps public health authorities to respond promptly and appropriately. For instance, during flu season, epidemiologists track the number of influenza cases to monitor the severity of the outbreak and determine the effectiveness of vaccination programs. 4. Public health interventions. Epidemiologists play a crucial role in developing and evaluating public health interventions. By studying the impact of interventions on disease occurrence, they can assess their effectiveness and make evidence-based recommendations. For example, epidemiologists have conducted studies to evaluate the effectiveness of vaccines in preventing diseases like measles, polio, and COVID-19. These studies provide valuable insights into the benefits of vaccination and help inform public health policies. In summary, epidemiology is a field that focuses on understanding the patterns, causes, and effects of diseases in populations. By collecting and analyzing data, epidemiologists contribute to disease prevention, control, and the improvement of public health.